Jane is wandering around the dental offices. She seems so anxious. Is there something wrong with her? Oh, one of her teeth is missing. She's thinking about all the horrible things that might happen. It looks horrible to me too. Oh my, he must be a doctor. Why don't we see what he has to say? The dental office doesn't seem so scary. Jane is talking to the doctor. Oh my, she can't stop thinking about that scary knife. If he is not lying, maybe surgery without using a knife is possible. He even showed a picture, so it must not be a lie. I hope.
Good morning, friends. My name is Dr. Sudhir Yadav, and I'm practicing in Gurgaon from last 22 years. And I'm director in Indian Academy of Digital Dentistry, Gurgaon Dental Academy, Muskan Dental Implant Center, and Dental Avenir. And I'm now associate with a digital dental club, started by Dr. Ajay Sharma. And first of all, I would like to thank dear Navy on behalf of Indian Academy of Digital Dentistry that they have provided us this digital platform to share our views. And first of all, let me tell you a little brief about Indian Academy of Digital Dentistry, in which we share our knowledge of digital dentistry with our colleagues. And for that, we conduct a lot of workshops all across the India. So friends, if you have any query or if you want to start a digital dentistry in your practice, you can contact us. There's no problem. So if you see in this society, from pin to plane, everything is digitalized, right from your payment options, your entertainment channels, and your social media also. And if you want to book any car, train, plane, hotel, everything is digitalized. So friends, if everything is digitalized, then why not dentistry? So that's why we started digital dentistry in our practice. And we are very happy with the kind of changes we are bringing in our practice. So today we'll mainly focus on the digital implantology. And as we know that this can be done in three ways. Either it could be a complete analog implantology, digital implantology, or a hybrid implantology. Now we'll see one by one. So if you see in analog dentistry, we place the implant free-handedly, and then after some time we make an impression, then we'll pour the cast and then mount it, make a die, wax up, invest, and cast or press, and then finally we'll deliver the prosthesis to the patient or a clinician. But these complete cycle is full of error. That's why I'm a little worried. Sometimes, when I place a free-handed implants in the patient's mouth, sometimes I feel if I would have put a place in the right or little left side, it would be a perfect placement. And when we make the impression and then we pour the cast, there are a lot of errors of expansion and shrinkage. So the impression is the first step towards your prosthesis. If there is an error in your impression or your placement, everything goes for the toss. But where in a digital implantology, when the patient comes to you in your practice, first of all, we make a digital scan, which is with the help of intraoral scanner, and then we'll take the three-dimensional data of the patients with the help of CBCT. And those data are used in a software, and we design the case virtually, and these surgeries are mimicked in the patient's mouth, and then we scan the implant with the help of scan bodies, then we'll design the case, and finally we'll print or mail the case. But in hybrid implantology, it's a combination of both actually. In free-handed implantology, like we place the implant and then we'll make the impression and send it to the lab. Here, a lab uses the lab scanners and they will design the case, and then finally they will send the final prosthesis to the clinician. But today we'll mainly focus on the digital implantology, right? So first of all, we need to understand the complete workflow of the this digital implantology. First thing first, we need to take the intraoral scan of the patient, in which we get the three-dimensional data of the soft tissue and the hard tissue, like teeth and gums. And after that, we need a three-dimensional data of the bone also, that will be taken by CBCT. And then we started designing the case in the software, and we do the surgery virtually in the computer, and these are transferred in the patient's mouth and mimicked exactly in the patient's mouth. Now, as we all know that the patient came for the tooth, the prosthesis, not for the implants. So we have two options: either we give an implant immediate restoration or a delayed restoration. If we're going for a delayed restoration, then after some time we have to go for a second surgery, and then we'll put a gingival former in the patient's mouth, and after 2 to 3 weeks we'll put a scan body and scan the mouth. But if your patient is looking for an immediate restoration, the company like DO will provide us customized abutment, temporary crown, abutment jigs, implant, and a guide. So with the help of these customized abutment and abutment jig, we can put the abutment exactly and in a right orientation in the patient's mouth, which we'll see few cases during our presentation, and we can give the immediate restoration with the help of these customized abutment like this, in which we have placed around 4 implants, and then we give the temporary process immediately. Here we have taken this picture on your left side immediately. The second day of the surgery. As you can see, there is no swelling, no inflammation. Everything is so natural looking. So if you're going for a delayed restorations, we need to take a help of a lab scan bodies, which we have seen in the hybrid type of implantology. So today we'll mainly discuss about the scan bodies. So we need to understand what are scan bodies. So scan body is a device which gives the information about the orientation and position of the dental implant. So here we have a small video regarding how these scan bodies help us in designing a final prosthesis. So we are doing.
This video will demonstrate the workflow for single implant interface application.
We'll take the help
Starting
of
on the patient's page, click
the software,
New Case
and we'll select the new case,
and select the lab.
and we'll select the
If you
laboratory.
only have one lab, this lab
And
is
after selecting
automatically
laboratory, we need
pre-selected.
to select the
The
teeth
order
which
form will
need to be
appear.
replaced. So
Mark the tooth that needs to be
so
restored.
we'll select the type of abutment we're
Click on
looking
the
for,
Abutment tab.
whether we are
Then
looking
select
for a
Abutment or Screw
retained
Retained
abutment
Crown
or
in the
a
Abutment
cement
drop-down
retained
list.
abutments. After selecting a type
Now
of
select the
abutment,
implant
then we'll
brand
select
in the
the
manufacturer
type
drop-down
of
list.
implant which we used.
Then select Implant System in the System drop-down list.
Whether it's a
And
narrow
specify the
platform
connection
or
of the
a
platform
roller
in
platform.
the Connection drop-down
And
list.
we can even select
Finally,
the type
select
of
the restoration
which we are
material
going to
in the
use
Material
and
drop-down list.
the
If you
shade of
select a
the
screw
final
retain
prosthesis.
crown, you may also specify a shade at this point.
So
The
we'll
emergence profile scan
to the
is
next
selected
level.
by default. This will add an extra scan to hold the shape of the emergence profile.
Okay.
This is the recommended workflow due to the ease of use. But you may
So
deselect the
we can
emergence
take
profile
a
if you prefer to
pre-preparation
scan
scan
only the
also.
scan
We
body.
can
Finally,
take a
you have the
emergence
option to
scan
add a
of the
pre-preparation
emergence
scan
profile also.
if needed.
So depending on the how you want to scan
Now
the
proceed to the scan page.
this scan
If you
bodies
selected
for
emergence
a
scan,
case.
you will now have
We
to
have
scan
two
4
techniques
scans.
which we
The
see
lower arch with
in the
emergence
next
profile,
few
the
minutes.
lower arch scan body,
Now we'll take 4
the upper
scans.
as opposing
The
arch,
lower
and
with the
finally
lower scan
the
bodies,
occlusion.
upper and
Now
occlusion.
proceed to the lower arch.
So we'll
There are
prepare
2
the
options to scan the arch with the implant.
scanner.
The
Now
first
we'll start
option is to
scanning
remove the healing cap, dry the
implant
area, and scan the emergence profile immediately
Without gingiva.
before the gingiva collapses. Make sure to get the entire area
then
covered well.
mark the tooth and
Then paint the
with
area
the
of the
collapse of the
emergence
soft
profile
tissue,
using the
we'll
lock tool
lock this area.
found under the Tools button.
So that
This will freeze the
even if
emergence
the soft
profile
tissue will
in its
collapse,
current
it
retracted
will not
state,
change the
thus preventing it from
digital
being
impression.
updated with later data when the
That's a
gingiva
great
may have collapsed. See the trim and lock tool video for further details.
Then
Then complete the scan using the official scan strategy, which is
if you want to take a
continue
partial scan,
scanning
you
the
can take a partial
occlusal
scan.
surface
If you
from
want
the
to take
implant
a
to
full
the
scan, you
canine.
take full scan.
Then, as
Here's
it is the
particular
lower
strategy
arch,
which is seen on the
slowly
left
roll
side
to
of
the
the
lingual
screen,
side
where
and
you
move the
go from
scanner
the
in
occlusal
the distal
side
direction.
occlusally and
Finally,
toward the incisor,
slowly
then
roll
lingually,
over the
and
left
then
molar
buccally.
and scan the buccal side.
Right? You mainly start from the occlusal surface because it has a bigger surface and it's easy.
The second option
Now
is to
we'll
leave
go
the
for
healing cap in place
with this
and scan the
scan
arch
body, we'll
following
scan
the
it.
official scan
Now,
strategy.
the other technique in which we scan the implant with the gingival former, the same technique.
Then trim away
Then
the
we
healing
remove the
cap
gingival former.
and its immediate surroundings in the scan with the trim tool.
We'll trim this area.
Remove the healing cap, dry the area, and scan the emergence profile immediately before the
Then
gingiva
we'll again
collapses.
scan it, and we'll scan in the internal part also. We'll scan the internal part of
No
the
matter
implant
which
also.
method you prefer, make sure that you cover the
then we'll
emergence
analyze
profile and the contact
scan.
points in this scan. Verify this
analyzing
by
the
zooming
scan.
in on the area, turn off colors, and rotate the scan.
Yes. So
Finally, mark the
we
preparation.
fix the scan bodies.
You will see a blue
inside the
overlay
patient mouth.
around the preparation mark, indicating the area that will be automatically cut out when going to the scan body page. If necessary, you may
Blocking this
reposition the
area.
pre-mark to obtain your desired cutout. You may adjust the
Marking
automatic
the top.
cutout radius under Settings,
And then
Scan, or you may turn it off
Put a
completely
scan
if
body
you
in the
prefer to
patient
trim
mouth and then
manually.
start scanning.
Make sure that all of the implant has been trimmed away, as well as the nearby surroundings. Insert the scan body and proceed to the scan body page in the top workflow bar. Start the scanner pointing at a neighboring tooth. Once the scanner has picked up the position,
This is how
slowly move to the
we're
scan
scanning
body
the scan
and
bodies.
circle around it to get it scanned from all angles. It is especially important to cover the upper third of the scan body to make it possible for the laboratory
Scan
to
bodies will give
recognize
you
the
the
correct
orientation
position.
and position of the
When the
implant.
scan body scan is complete,
patient's mouth.
remove the scan body. Click Next to scan the upper arch
Now we'll go
as
to
our
next.
antagonist. Follow the official scan strategy,
Now we'll
which
scan
is
the upper arch.
start by scanning the occlusal
On the left
surface
side, as you
from
can
the molar to
see
the canine.
can see the
Then,
strategy
as it
of the
is
scanner.
upper arch, slowly
From
roll to the
occlusal,
buccal side
we'll,
and
from
move the
molar
scanner
to
in the
incisor,
distal direction.
move towards the incisor.
Finally,
and then
slowly
go
roll
to the
over
buccal
the
side
last
and then
molar
go to
and
the
scan the
palatal
palatal
side.
side.
It will done in few seconds.
Then scan the bite. Ask the patient to
Now we'll
bite
see-
firmly and scan
register
until
the
both
bite.
scans snap into position and the arches are aligned.
Make sure
The scan
3 or
should
4
cover
teeth
at
should
least
be
3 to
involved.
4 teeth for perfect alignment, even if the scans snap
Great.
together earlier. Switch to the Analyze page to confirm that there is enough space for the reconstruction between the upper and lower arch. And
now we'll see the
optionally, add some
clearance.
comments or shade measurements.
You can see the shade also. The complete detail.
Finally, go to
Then
the
we'll
send
send
page.
it to the laboratory. But before sending it to the laboratory,
After verifying the order,
Complete
press Send
order
Order.
form, and then we'll send it to the lab.
Now you know the workflow for
Easy.
implant restoration. Thank you for watching.
Thank you for watching. Now we'll move on. So friends, first of all, we have to understand the scan bodies. So DO are offering us scan bodies which is known as H-scan bodies because they act as a healing abutment and a scan adapter. So after scanning the patient's mouth with the scan bodies, and these scan bodies have information about the implant, and we can get these information with the help of a library which we put in the scan body, impression of the scan body, and we get the complete information. So every system has a different libraries which gives the complete information, the orientation, the position, the thickness of the soft tissue, everything will be you will get all the informations. So there are different shapes of scan bodies. For incisors, they have a different scan bodies. For premolars, they have different scan bodies. For molar, they have different scan bodies. And these are basically the cross section of the tooth is coincide with the outer shape of the scan bodies, as you can see in the picture. So they come with the different numbers like H scan 661H, 561, 662. So it's an indication. So first six, like if you see the H scan 661, the first six is the height of the scan body. Next six is the diameter of the scan body, and one is the cuff height or a soft tissue thickness. Okay, so they have a different number, have a different importance. They have different importance. So now they comes in the three different heights: 4 mm, 6 mm, and 8 mm. Right. So basically, the outer shape of the scan bodies coincide with the internal shape of the implant, as you can see in the picture. So we'll see the digital processes one by one, step by step we'll go. So when we scan the scan bodies and get the information of the upper and lower arch, we put a library on the third picture. As you can see, we put a library on the scan body and get the complete information of the implant operation and placement. And after receiving these details, we virtually started designing the final prosthesis, and we do the virtual articulation side by side also, and then we get the final outcome, which was transferred in the patient's mouth, beautifully placed. Understood? So I would like to share a new abutment, which is known as a digital abutment. I called it a rising star because it has a multiple purpose, and they have a different parts. They have an upper part of the abutment, the lower part, and the cuff height, the shoulder margins. So they have a different, every part has a different importance. Like if you see, this is called M25 abutment. It means this is an abutment of a molar. And the cuff height, which is a soft tissue thickness, is 2 mm, and the post height is 5 mm. Great. So it has three different functions. It can be used as a temporary abutment for the temporary gingival former and a soft tissue adapter. So it becomes very easy to transfer this abutment in the patient's mouth. Only thing which required is a carrier. So this driver with the help of this driver, it becomes very easy to transfer this abutment in the patient's mouth. This carrier prevents screw from dropping into the patient's throat, and the design is easier handling and precise connection. So it becomes very simple and easy. So if we compare the analog method and a digital method, depending on the soft tissue, if the margin line is subgingival, it is hard to take an accurate impression and leads to the inaccuracy of the processes, right? But in case of digital abutment or a digital abutment, even if the margins line is subgingival, digital process uses the library system to make an ideal results. It doesn't even require a gingival retraction cord because everything is digitalized. So if you placing the implant and putting a digital abutment, so it acts as a gingival former, as well as it becomes very easy to give a temporary process at the same time. So it has a triple action. It acts as a healing abutment, a scan body, and a final abutment. So for different areas, we have different digital abutments. For incisor, premolar, molar, canine, they have a different kind of abutments. So if you see these different abutments, if you see the cross section of these abutments, they mimic the cross section of the particular tooth. Like if you see the M25, which is a molar abutment, it mimics the cross section of the molar. If you see L25, its cross section mimic the cross section of the lower incisor. So there are different parts of the digital abutment. The upper part is a scannable, which is a little rough, and the lower part has a protecting this lock groove to lock the temporary crown or a protecting cap. And then they have a shoulder margin, and then they have a cuff height depending on the soft tissue. Now this connection can be of narrow connection or can be of regular connection. So they have three advantages: customized abutment, temporary crown, and a scan adapter. So friends, now we'll see a few cases of DeoNavi. So this is the first case in which the patient has had a fractured 4-1, which was endodontically treated, and it becomes very difficult to extract this kind of incisors atraumatically. So we use the magnetic mallet to extract this tooth, which was done atraumatically. So first of all, first thing first, we have taken an intraoral scanner. With the help of intraoral scanner, we have taken the 3-dimensional data of the soft tissue, and with the help of CBCT, we have taken the 3-dimensional data of the hard tissue. So then we place this data in the software and design the case virtually and send the surgical report to the dentist or implantologist. And then virtual implant placement was done in the software, and then because patient want this process immediately, so we designed the case in the same time and then done the 3D printing of the final prosthesis. So this was the fractured 4-1. Atraumatically extraction was done. So then we put this guide in the patient's mouth, surgical guide. But before starting a case, always recheck through this window whether your guide is completely placed or not. And then we mimic the surgery in the patient's mouth. And since we are going for immediate temporization, so with the help of this abutment jig, we give a right orientation of the abutment in the patient's mouth and give the temporary immediately. As you can on the right side, the jig with the help of adjacent tooth, this jig will fix in the right direction. So this is a temporization, immediate temporization. So in case 2, the patient had lost 1-1 and 2-1, and for last 7 years, and she was using a flippers, and she was not happy with the removal partialitures. So she was looking for some fixed options, but during this 7 years, there was severe labial resorption. So we decided to go for a second stage surgery. So this was the case. Virtual designing of the case was done, and decided to place 2 implants of size 3 by 13 mm. And this was pre and post surgery. And then after a few months, we put a scan body in the patient's mouth, and then we'll scan it. After scanning, we started designing this case virtually, and 3D printing was done, and this customized abutment was placed in the 3D printed models, and these were transferred in the patient's mouth. And this is the final outcome. So in the third case, in which patient has missing canine 1-3 since the childhood, and patient was not happy with his smile, and he was looking for an immediate restoration also. So what we've done, we start with the intraoral scan, the patient mouth, and then the CBCT was done, and in the CBCT, we have seen a horizontally impacted canine, and when we check the vertical height, we can able to place the implant. So designing or virtual planning was done, and since the patient want immediate temporization, so we have designed this case in Exocad. And this is immediately after the surgery. We place the implant, then put a abutment, and finally we place the crown within an hour. So this is the fourth and the final case in which we have used digital abutments. Again, we have taken the 3D data of the patient, soft tissue as well as the hard tissue, and this was missing 4647. Sorry for the incomplete pictures. And then we'll check the seat of the guide, and with the help of this guide we place the 4647, and these were the digital abutment which we have placed, and then we give the temporary crowns immediately. Beautifully placed. So friends, these are the few cases which I have selected for you. So before ending my presentation, I would like you to see this video which I made for Indian Academy of Digital Dentistry and Dio Implants.